I am Dr. Vijay Bhaskar, Masters in Orthopedics, Professor in a medical college, and I am a Chairman for Ethics Committee, Clinical Research and Trials. In diabetics, there are certain people are under not controlled, where in diabetic patients they will have certain problems. Usually what we see in diabetic is wherever there is uncontrolled diabetes, there is a possibility of trivial injuries or major injuries or contaminated injuries or open injuries, where patient will develop the infection, and then if not controlled, then there is a chronic osteomyelitis. Where there is a simple injuries in children, where there is accumulation of the blood in the joint or anywhere part of the body, there is a possibility, if the sugar is not under control, possibility of infection, and that leads to chronic or acute osteomyelitis. Apart from this, and then there is a orthopedic tendinitis, orthopedic problems like tendinitis, synovitis, where the sugar is not under control, various muscles, tendons and the ligaments get infected possibility, and there is a local inflammatory reaction because of the infection. Uncontrolled diabetes leads to chronic problems. So obviously we must know that when there is a certain types of heel pains, where the people with the uncontrolled diabetes, where due to cracks in the sole, the bone or the tissue gets infected with the bacteria, which is not taken care properly with the diabetes control and antibiotic, there it leads to a chronic heel pain. So like such that in orthopedics, there is a possibility of arthritis, there is a possibility of tissue infection, there is a possibility of osteomyelitis, there is a possibility of the bony osteitis, and back, there is a possibility of psoas abscess because of the tuberculosis. And wherever there is, then when there is a sugar is not well controlled, that means the fasting blood sugar should be below 110 and the post-lunch blood sugar should be below 180, and the HbA1c should be below 6. So when you don't maintain these levels, then there is a possibility of any problems in the orthopedic issues, then that will aggravate with the uncontrolled diabetes, and then will lead to a certain chronic problems, where the person will suffer for longer time to heal it. So I ideally say that the proper diet, proper food, proper medication, even if necessary insulin therapy, and as well wherever there is orthopedic problem rises, there we should give an attention to treat it locally, and then manage both together with protocol way, so that any other problem should not develop. Thank you.